Explanation, introduction. Do you frequently feel like your heart pains sometimes? That uneasy feeling shows how sudden symptoms can catch us off guard. Adrenoleukodystrophy, ALD, is a rare brain disorder that often starts with very subtle changes, like a child getting slower at school or a teen feeling clumsy. The goal here is to explain those hidden clues in plain language, so you can recognize them early. Etiology: causes: ALD is caused by a tiny mistake in a gene called a BCD1, which sits on the X chromosome. Think of the gene as a recipe. When the recipe is wrong, the body cannot break down very long-chain fatty acids, VLCFA, properly. Those fatty acids pile up, especially in the nervous system and adrenal glands, and slowly damage the myelin, the protective coating around nerve fibers. Because the gene is on the X chromosome, boys are usually affected, while girls may be carriers or have milder symptoms. Signs and symptoms. The first signs can look like everyday trouble. Ask yourself, is my child losing focus, stumbling more, or having trouble reading? Common early symptoms include trouble with coordination, often described as clumsiness, declining school performance or trouble understanding spoken language, vision problems such as blurry or less colorful sight, hearing loss or frequent ear infections. Later, stronger signs appear: loss of muscle strength, seizures, and adrenal insufficiency that can cause fatigue or low blood pressure. These changes happen quickly, sometimes over months, so early detection matters. Diagnosis and treatment. Doctors start with a simple blood test that measures VLCFA levels. High numbers point toward a LD. If the test is positive, a brain MRI shows characteristic white matter damage, and DNA testing confirms the ABCD1 mutation. Treatment options include hematopoietic stem cell transplant, HSCT. If caught early, it can stop brain damage in many cases. Lorenzo's oil, a mix of special fats that may slow VLCFA buildup, most useful before symptoms appear. Gene therapy trials that aim to replace the faulty gene. Supportive care, physical therapy, hormone replacement for adrenal problems, and seizure medicines. Think of treatment as a toolbox. The best tool depends on how early the disease is caught. Prevention. Because a LD is genetic, you cannot stop it from happening, but you can reduce surprises. If a family has a known case, carrier testing for relatives and prenatal genetic testing for future pregnancies are available. Genetic counseling helps families understand the chances of passing the mutation to children and discuss options such as pre-implantation genetic diagnosis, PGD, with IVF. In everyday life, regular checkups for at-risk kids, blood VLCFA tests, act like early warning lights that let doctors intervene before big problems develop. Recent research or advances if available. The past few years have seen exciting steps forward. A landmark study in 2023 showed that a single-dose gene therapy can stabilize brain disease in young boys for several years. Researchers are also testing CRISPR-based editing to correct the ABCD1 mutation directly in stem cells. Another promising avenue is improved HSCT protocols that use less intense conditioning, reducing side effects. Finally, new MRI techniques can spot tiny changes in myelin months before symptoms appear, giving doctors an even earlier chance